Welcome to the Rehab Link Secrets to Success podcast. I'm your host, Lisa Chase, and I would love to welcome our guest this morning, Kirsten Snellenburg. Good morning.
Good
Welcome.
morning. Good morning.
So Kirsten and I have known each other quite a long time. We've kind of been on a journey together,
Yes,
haven't we?
we have.
So I
Yep.
met Kirsten many, many years ago when I was on the tour, and she had a private practice.
Yep.
And we needed some physical therapy for some of our staff members and some of our players. And that's kind of how we got introduced,
Yep.
really via phone. We had actually never met in person.
Right.
And it wasn't really until years later that we met in person. Actually, I think it was through Liz, where
Right.
we kind of reconnected when Liz was working
Right.
at the clinic, and
Right.
then we reconnected. And then I know you're going to talk about the clinic and that you
Right.
had and kind of how it led to you coming to back to normal. So
Right.
which
Right.
I'm
Right.
which I've just
Right.
loved working with you. It's been super fun. So
Oh,
so why don't you tell our listeners a little bit about your background? You've got a really eclectic background, and I'd love for them to hear a bit more about, your background and where you come from and kind of where you are today.
okay. All right. Well, I grew up in Long Island, in a very small town called Southold. It's on the east end of Long Island. People think of Long Island as a city, but it's not. Um, there was there's a lot of country out there, and at that time there was a lot of farms and fishermen and potato farms, things like that. My high school class was 52 people. Yeah, it was that
Wow.
small. Yeah, and everyone knew each other in the town. Actually, the one of the one of my good friends I went to nursery school with, I just had coffee with her a couple of weeks ago at home on her porch. So that was interesting, it's been a long time.
Yeah.
Yeah, really a wonderful place to grow up and a safe place to grow up. And then during that time, I was really into sailing. My father was into boat sailing. He taught me how to sail sailboats, and we took lessons and sailed all summer. That was one of the things I was always on the water and in the water. Um, and when it came time to go to college, before that point, I had started learning how to windsurf, and that was when windsurfing was really new. And I won a regatta. East Coast, it was the East Coast Championships, and the manufacturer, which was called Sail Rider at the time, told me they would sponsor me. So I started windsurfing between 16 and 20 years old, 18 years old, 19 years old. And I was traveling around with these guys. I can't believe my parents let me do it, but we went all over and competed. And then I decided to go to a college in Florida called Eckerd College because it was on the water. I graduated from there in my undergrad, and during that time, I also competed on the sailing team, and I was also on a maritime rescue team there called XR. They're a volunteer rescue team here in Tampa Bay, and I learned a lot about, just maritime rescue, boat driving, all kinds of things like that.
Mhm.
Um, and so then once I was done with that, I started competing with the U.S. team. I qualified to get on the U.S. Board sailing team and U.S. sailing team. So I competed as an athlete, as an Olympic athlete, for many years until '93, when I stopped competing and started coaching. I was kind of doing both international teams and some U.S. stuff, and then I started coaching for them. And during that time, I went to Oklahoma to the Olympic Festival. I was a coach there, and I saw one of the physical therapists on the other side of the tent, and I thought, I don't want to do this anymore. I want to do that. So every day I got up and I went in the village, Olympic Village, they bus you to your event. So every day I ran to the bus in the morning at 7 in the morning. I wait for him. I'd stand next to him, get on the bus with him, sit down next to him, and ask him, how did he get to PT school? Because I thought this is what I want to do next. And he told me, his name is Barney Poole. He became the president of the Georgia Physical Therapy Association, had a bunch of clinics in Georgia for a long time. But he taught me how to do it. I then applied. During that time, I had to take a year of prerequisites, and I went to massage school to see if I wanted to be a PT. And I really realized I wasn't treating the uh, cause, so I knew that I had to do physical therapy. So I applied to about 10 schools, got into Nova, got
Mhm.
into 2 of them, but Nova Southeastern, and they were problem-based learning. So that
Mhm.
was a wonderful experience, a 2-year master's degree. And then I came out of that. I started working both teaching anatomy and massage at the massage school, and I also at Humanity Center, and I also worked in an outpatient. And I did a lot of neurovestibular patients in that outpatient. I trained under Norman Schlack, who trained me in vestibular, neurovestibular central lesions, peripheral lesion. It was amazing. Um, Learned a lot from him, a lot, and he was a Paris trained certified therapist. So I decided to do that, my doctorate work at St. Augustine, and so I
Mhm.
finished. I did a doctorate at St. Augustine University. Um, and then during that time, I started getting frustrated because the insurance companies were really kind of limiting the how much reimbursement. And then we were being told, work on that patient for 30 minutes, work on this patient for an hour. And I was getting frustrated. Um, and that's when my business partner at the time had come a couple of times to me and said, "Hey, let's open a practice. Let's open a practice." So I thought about it, and that's when we started talking about that. So yeah, so that's my journey as a coming into physical therapy. So,
Yeah, so so you had your own clinical practice,
yep,
and then you decided to leave that clinical practice and go
yep,
into teaching. And so
yes,
now tell us about where you're at now, because you are teaching in several ways. One for the PTA school at St. Pete College, and then
yep,
also for Jean-Pierre Barral at the Institute
yep,
for
right,
Visceral
right.
Manipulation. So yeah, tell us a bit about that.
Yeah. So at St. Pete College, we have a physical therapy assistant program. So I'm one of the lead faculty there. I teach neurology, teach I was teaching the advanced TheraX, and now I'm teaching some of the ortho A and K stuff, or anatomy kinesiology material. I love the neurology, like that's my thing. I love teaching that. And
Yes.
then with because I have studied the visceral manipulation for so long, decided that I wanted to help them. So I'm a TA. I help with certain classes, the beginner classes with the visceral manipulation. And I also run a study group here in St. Pete. I've done it for about 5 years. Actually, at Back to Normal, we do it in the spring every third Saturday. So we always have a visceral study group going on between spring and summer. Mhm.
So let's tell our listeners a bit about visceral manipulation, because those that are listening may or may not, understand what it is and really how it integrates. So, at Back to Normal, we do have a whole body approach, and it is an
Right,
orthopedic, sports
right,
medicine, right, practice. But talk about visceral manipulation and how it kind of fits into that picture and that
right.
model.
Right. Well, visceral manipulation is a form of osteopathic treatment. It goes way back with in osteopathic theory, and as you know, every single tissue in the body has sensors and receptors that tell us where we are and how we're functioning. Um, so the visceral manipulation really on the organ level can really both affect how we function, how we stand, how we move. Um, and there's two ways of looking at it, both mechanically or mobility wise, and then motility wise, which is the inherent motion of an organ. Just like your intestines is always moving to digest, there's an inherent motion of every single organ in the body. So it can really become a great tool in your toolbox to have. I um I was trained in Paris for the spine, which it was very good as far as being able to learn spinal mobility and getting things moving, and then having that piece of the visceral manipulation is just another tool in the toolbox to really help treat the whole body, everything on that nerve segment that's being affected by the lesion or the dysfunction within that body system. So it really can make huge difference, huge changes in your treatments and your outcomes. Um, and I don't know. I've also done some cranial work with both Upledger as well as with Dr. DiStefano at MSU. And that tool as well can help. And then I've taken some of the Baral neuromeningeal courses that also look at the cranial system and the nervous system. So having an eclectic kind of combination of many tools can really help to listen to the whole patient, to look at the whole system. You
Yeah, I
know,
think
yeah.
that is so critical. As a therapist, as you're developing your skills, really looking broadly
Hmm.
and having many tools in the toolbox because, there's all the, one tool does not work for all.
It does not. It does not. It does not. It does not. And visceral manipulation is an amazing piece. I mean, I had a patient, it was a few years ago, I had a patient that came in and the doctor said she had a hip replacement, 11 months ago, and she's still not walking, and she's walking on a walker, but there's nothing wrong with her hip.
Yeah.
Can you please take a look at it? And so she came in. I went ahead and I did a general listening, and then it's a form of evaluation in visceral manipulation, and then we did a local listening where you look at the body, and I found that the liver was definitely not moving well mobility wise and not having its inherent motility. So I treated the liver, um, and the patient got off the table and was able to stand on one leg. She was 75 years old. She walked around the room, then she walked around the clinic. She's like, "Oh my god, I can walk." And it's, "Yeah, yeah." So something must have happened, between the time she had the
Sure.
surgery, maybe they moved her or she moved a certain way, and that whole system was off, and the body was getting a signal. The cerebellum was getting a signal, "You're not in balance, you're not in homeostasis." So it's interesting, it's an interesting tool to have with you, to
It
help you.
really is. And, there have been, that's what, love having you in the clinic, because you are really, have fine tuned your skills, when it comes to the listening and the visceral manipulation. And it's just so great when we're like, okay, we've tried everything.
Structurally, yeah.
And then, you tap into the visceral, or some of the meningeal work that you've done, and it's amazing.
Yeah.
So yeah,
Yeah.
I think it
Yeah.
is definitely is very valuable tool.
Yeah.
Um, all right, well, let's get into some valuable tips because I know you have several that you feel have really impacted your clinical outcomes, right? Because at the end of the day, we have patients that come to us and they want to get better. They want to get
Right.
out of pain. They want to get back to doing the activities that they love.
Mhm.
And so I'd love to hear your key clinical pearls.
Right, right, right. Um, well, I would say one is the pearl for most practitioners that are coming out of school is develop your evaluation and listening skills. And as a manual therapist, you really, as Jean-Pierre said, be proud of your hands. Your hands will tell you everything. So one of the things is develop your listening skills. That's really critical. And that just not listening to the patient verbally. I mean, we're talking really feeling what's going on in the body itself. Um, the second tip I would say is look at the body as a whole system, including the brain and emotion. Um, you know, Jean-Pierre is doing a whole program on the brain, and our brain is the command center for everything we do. It's how we assimilate and then move. So, and the brain also takes in emotions. So, being able to kind of connect those things as you get higher up in the visceral practice, you start to learn how to um, work with the emotions and the organs. So, really looking at the body as a whole when you're working with the patient, and then trust your hands. I would say the third thing would be trust your hands. What your hands are telling you is accurate, right?
That is true. And it takes practice,
It does. It does.
it takes practice to clear your mind. I know that's something
Right.
you do every
Right.
time before you go to evaluate, somebody. So just kind of clearing yourself,
Right.
and then, really being able to listen, both with asking the right questions verbally and
Right.
non-verbally.
Right, right, right. And for me, when I first started my listening skills in the visceral work, they teach you a specific way of learning that, both general listening and local listening. I really had to, when I would come out of a course, my my clinics that I had owned. I had insurance patients, a lot of patients coming in. We were one of those clinics that every 30 minutes a patient's coming in. So I just would decide after a course, I say, okay, I learned this technique on whatever, the liver. Every I'm going to listen to the liver for this week, and
Yeah.
I'm going to do the technique on these patients, and that's how I was able to do the technique, 100 times,
Yeah.
over the course, to get your hands really, really specific to that technique. So you're getting better and better and better in that technique system. So
I think that's actually a really, really great point because, as therapists, we go to all these courses, we learn all these techniques, but to really master a technique, you have to do it, what do they say, 10,000 times
right,
or,
right,
right?
right,
So,
right, right, and
so
right,
really coming up with some kind of a system like you just described, and I did the
right,
same thing when I first started teaching at Michigan State. I was
yeah,
like, every single person, I was like looking, okay, I'm looking and I'm testing and I'm,
right, right,
making
right,
sure, that I really wanted to get it down. And, another point is, which both of us do, is teach. Because
right.
one thing is to do it with patients, another thing is to teach it. And when
Correct.
you teach it to patients, when you teach it to other students, when you teach it to other therapists and practitioners, it really helps you to learn the material even better, right?
Oh, yeah. Oh, yeah, and it was very funny with with these patients when we first started. The clinics that I owned, they were mainly orthopedic patients. There was neuro patients too as well, but, mostly, spine, knee, shoulder, things like that. So, I started doing the VM work. I would do a technique on a patient. They would come in the next time and they're like, "Can you do that thing you did? Whatever you did, I'll do it." And they would stand up, turn around and put my hand on their head and feel, and they're like, "Whatever you did, that stuff, just do it again." I'm like, "Okay." And then it got to the point where the practitioner, the doctor would say, "Whatever you're doing, keep doing it." They would just call me and say, "I don't know what that is," especially the MDs, they're not
Right.
as familiar. The osteopaths would specifically refer a patient for a whatever, a pelvic issue or that type of thing, an
Yeah.
intestinal issue, a colon issue.
Yeah.
But yeah. it was very funny. It was a funny thing to see my patients transition into how they loved the visceral work in combination with the other materials.
Yeah.
Yeah, it was good.
Yeah.
It was cool.
That's very cool.
Yeah.
Well, I know that, you have a particular audience, right, through teaching,
Mhm.
both at the college and, with the visceral work. So what would you say that your listeners really appreciate most? And what kind of advice can you give in relationship to that?
I would say be open to learning.
Mm,
I'm almost 60 now, and I would say the biggest thing is don't stop learning, don't stop having an open mind to learning new things,
yes.
and really just absorbing. I was at a course with Jean-Pierre last summer, and I asked him some questions about his work, and he said, "Oh no, I study anatomy every day, Kirsten." And I was like, so I started doing it again. I looked at a lot of neuroanatomy, but not structural anatomy. So just
Yeah.
being open to take, if this practitioner, take the pieces that you really, and really be open to listening and learning new things.
Yes.
And the other piece I would say is that uh, with with my love of visceral manipulation, the organs echo emotions. So,
Mm,
really understand that when we have an emotional response, our organs are the ones that first get hit with that emotion. Most people think, oh, it goes to my muscle in my neck. Well, when you're frustrated or angry, really, does it go there? It actually goes to your gallbladder. Your gallbladder is the one that gets all upset and angry, and, your liver, gallbladder, and then you start feeling that referral to your C6, C5, that nerve root area that it's coming from. So
yes.
really being aware that your organs do echo the emotions and kind of tying that in with your patients. So, yeah.
Yeah, that's huge. I
Yeah.
love that part
Yeah.
of
Yeah.
visceral. I think it's
Mhm.
yeah, to really understand that really helps in approaching, a patient and being able to guide them. And sometimes just bringing awareness, right?
Right.
I know you've
Right.
done that, quite a bit, with just doing your readings, asking some questions, and then bringing some awareness to stuff that's really sitting under the surface,
Right. Right.
heavy in the
Right.
emotion.
Right, heavy in the emotion. Exactly.
Yeah.
Exactly. Yeah, yeah.
Yeah.
So I hope that, people when they hear this podcast, they're curious about uh VM work, visceral manipulation
Yeah.
work, and they at least, try it, have a session, or if they're a practitioner, that they really want to try to just take basic visceral one, and learn the structural components that, tie into your nerve segments in the body, and how that can help as a tool, you know?
Yeah, I would absolutely highly encourage, to take that coursework. And, even though like you are much more skilled in doing visceral than I am, just having the awareness,
Right.
being able to do some of the listening,
Mhm.
and then, look, if you're not an expert in it, find an expert in
Right.
your, I know that through the Baral Institute, right, you can go and you can
Oh,
look
yeah.
for people that are certified.
Mhm.
So people that are listening to this podcast, that is also a resource, right?
Right. It
One
is.
is if it's not, solely your interest, it's not something you really want to do, then it would be great to have a resource in the community. And there are many practitioners that do it. And so I would highly recommend at least
Yeah.
learning a bit more about it and connecting with somebody who is very skilled in it, because it is
Right.
very impactful for sure.
Yeah. Yeah. And we, at Back to Normal, we have a visceral study group, um, every 3rd Saturday in the spring. So I would if a practitioner wants to come and be a model, or they want to experience a little bit of visceral work, you can go ahead and reach out to me, and I can do, a 15-minute session for them to experience a little bit about it. So
Yeah.
that's, especially for the practitioners, the therapists that are curious about it, that'd be great.
Yeah, that would be great. So then let's just tell our listeners how they can find you.
Okay. I am at Back to Normal Physical Therapy in downtown St. Petersburg, Florida. Um, and you can call the clinic. The clinic number, what's the clinic number here? I have to look that up. Oy vey.
So yes, they can call the
727
727 362
362.
6866.
Yep.
And absolutely, there's information on our website
Yep.
about
You can
you
email.
and about
Yep.
visceral manipulation. Well, I so appreciate you, first and foremost, as a friend. You've become a really wonderful friend and
Oh,
a
thank
great
you.
support system. And I love having you in the clinic, your energy, your expertise, and really helping, our other therapists to become better with their hands and to listening to patients, always being that sounding board.
Well, thank you. I love the clinic that I'm at now. I love you. You have been an amazing friend, and a great mentor, as far as just kind of learning more, and extending myself, in other areas of osteopathy. So it's just been a great experience to be in that environment. And any patient that walks into that clinic, they immediately know the level of care they're going to get at that facility, for sure. Yeah.
Well, it's, bringing a great team together, which we
Right.
do have, all the
Right.
way from the front desk to all of our,
Right.
therapists and instructors. So it was certainly a team effort, and
Yep.
I appreciate you.
Yeah. Thank you, Lisa. Thank
All
you.
righty. Until next time, keep getting great outcomes.